Hello, welcome to our frequently asked questions. Today I'm answering a very commonly asked question: will I have pain after upper blepharoplasty? And this is a question that many patients can feel a little concerned about, and so we'll talk through this. My name is Dr. Julian De Silva, and I'm a London-based facial, cosmetic and plastic surgeon, and blepharoplasty is the commonest procedure that I complete for my patients. And the information that we're talking through today is information that I discuss with my patients every day. So will I have pain after upper blepharoplasty? Well, upper blepharoplasty tends to be a procedure that has relatively little or minimal discomfort after surgery. And although certainly a number of patients can be quite concerned about this, and I certainly give all my patients a prescription for analgesia and pain relief medicine, more than 50% of my patients never use that analgesia, and the other 50%, may use 1 or 2 tablets on 1 or 2 occasions. But generally speaking, upper blepharoplasty is a relatively comfortable procedure with a fast recovery. There are aspects of the surgery that can be very relevant, and I certainly with my technique use a mixture of longer acting local anesthetics, and these longer acting medicines mean that you are comfortable for many hours after the surgery because the numbing agent lasts for many hours, and many patients do not need to take any analgesia or pain relief medicine after this point. Other things that can make a difference in terms of your recovery is using cold compress or ice. And ice, not only will this help reduce swelling and improve your recovery, but it also can make the area more comfortable. And I give patients detailed written information on how to do icing, generally 10 minutes for every hour for the first 3 days. And not only will this improve your rate of recovery, but it will also reduce discomfort. Every patient is different, and when it comes to discomfort, the level or threshold for what patients perceive as discomfort can vary from person to person. And this is what one of my patients described their experience in terms of discomfort. And on the way home, I was feeling a little sore, and I took 2 paracetamol tablets and fell asleep in the car. I took 2 more tablets at bedtime, but that was all the painkillers I needed throughout. This is a patient of mine who had upper blepharoplasty under local anesthetic, and I would say this patient is a little more sensitive and more anxious than many patients. And this patient actually spoke to 2 other patients of mine who'd previously gone through the surgery in order to feel comfortable about the process. And that is one other recommendation I could make to you is if you are feeling quite anxious about having upper blepharoplasty, it's quite reasonable to ask your surgeon if they could put you in contact with 1 or 2 patients who've undergone the same procedure so that you can feel more reassured about what you're undertaking. Will I have discomfort after upper blepharoplasty? Well, generally speaking, upper blepharoplasty is a relatively comfortable procedure, and most or half of patients do not require taking any pain relief medicine, and the other half may have a mild ache or mild discomfort and take analgesia once or twice in the first 3 days. But generally speaking, the recovery from upper blepharoplasty is relatively comfortable. I hope this information has been useful for you. Thank you for watching.